Hello, I'm Dr. Gökay Bilgin from Smile Hair Clinic. So we are going to check our patient Nicholas' hair transplant journey. Let's check the before photos. So he has a very obvious hair loss in the frontal part, frontal half of the hair. He still has some hair, but they are really tiny and probably he will lose them in the upcoming years. And also he needs a really density increase in the right part of the crown. Actually, this kind of patients can be done in 2 sessions, but I always like to give a chance, if I can, to create a decent density in 1 session. So maybe the patients will be happy about it and maybe they will come for the second session not 1 year later, but maybe 5, maybe 10, maybe 15 years later. So in the first month, we see that the transplanted hair grew well, but of course he lost many of them. And actually in the top, we also increased density. So you can clearly see in the top and the crown the implanted hairs. And his donor zone seems nice, but of course, if you look at this very closely, you can still see that hairs are extracted from the donor zone. Some patients really get frustrated about this look because they will think that it will look always like this, but you must keep in mind that it will look much more better in the upcoming months, especially after the first month. So sometimes people ask others that what happened to my donor zone, will it still be like this? You don't need to worry about. As I told you, it will look much better after the 3rd month. Let's go the 3rd month. In these photos, you can see that donor zones seems much better than the 1st month. And also, you can see he lost most of the implanted hair. Some of them are still there, but they are very tiny, like baby hair. Their texture is much more different than the native hairs that were already there before the transplantation. But I must say that his 3rd month result is promising. And if we check the 6th month, we will see that his hair starts to grow, but still not really promising, especially in the crown. The crown seems still empty, and when he combs his hair back and he uses gel, you can clearly see that the frontal density is not at the level that we expect to be. And when we go the 9th month, his donor zone is nice, it looks well. There's nothing wrong in the donor zone, and the frontal part of the hair seems really nice and dense, and also the crown has a nice density. Of course, we could add more density on the crown and in the front too, but it would be over harvesting. So as I always do, I try to create enough density that patients will be happy in 1 session, if I can, of course. For some patients, it's not really can be done. For some patients, it's not really easy for us to cover the whole head in 1 session with a decent density. But for this patient, we went for it, and even at 1 session, it looks pretty nice because we fixed nearly the whole head. We created a new hairline, we covered the frontal part, and also increased the density on the top and the crown. It's a fact that density will get much better in the upcoming months, especially after the 9th month till the 12th month. His density will increase. Thank you.